Hello? Okay, everyone can hear me, I'm sure. I'm gonna I'll stand right in the middle. Welcome everyone. This is night 2. This is the final night of the Kootenay Boundary Medical Cannabis Conference. Once again, from the 3 directors of the Kootenay's Medicine Tree, Wendy Briscoe, who is unfortunately not here with us tonight, Martin Wires, and myself, Jim Leslie. We want to thank everyone for coming, and hope you all enjoyed last night's presentation, those of you who were here. Those of you who were not, this is going to be a fantastic night. We're really, really lucky to have Dr. Zach Walsh joining us for tonight's presentation. So you're in for a real treat. Just before we get going, this is the way it's going to work. We're going to have a presentation by Dr. Walsh, and then after that, directly after, we're going to go to the feature film. We're not going to take a break. Just so everyone knows, if you would like to take a break, there's a question and answer period. I would encourage you to stay for at least some of the questions, but that's probably a better time if you want to take a break before the film is towards the end of that. So, basically, after last night, we looked at hemp. We looked at the different uses for industrial hemp. We also looked at the basics of medical cannabis, and shared a lot of information, and it was great. So tonight, we're going to get a little bit more specific. We're going to hear about some research now that is ongoing and new and Canadian, which is fantastic. We need to take our place at the head of the pack in the world when it comes to medical cannabis research, and we're getting there, and it's because of professionals like Dr. Walsh. So I'll give you a little background on Dr. Walsh, and actually, you know what, I just interrupted myself. Before I do, I want to make one mention, and I wanted to talk a little bit about this last night, and we kind of rushed into the presentation, but I wanted to recognize we have 2 representatives, 2 special guests tonight, representing Medical Cannabis Foundation for Kids, Kyla's Quest. In the house tonight we have Elaine Newsler. She's down in the front. Elaine. This is Kyla Williams' grandmother. And with her is Susan McIver. She writes for the Penticton Herald. And she is here also as a representative of Kyla's Quest. And Kyla's Quest, round of applause. Just to let you know what's going on, Kyla Williams is a beautiful little girl who basically has dealt with a very serious epilepsy. And it came on shortly after she was born. She has been using CBD in oil form, and she is doing very well. And for those of you who aren't familiar, check her out on Google, go to Kyla's Quest website, and please support the foundation. They're doing important work because the kids that are using this oil, it's not covered by any healthcare plan, so they're really at the mercy of their personal finances, of their families, and unfortunately at this stage CBD oil still costs quite a bit by the milliliter or by the gram because of the imperfect situation we're in with access to it. So I wanted to recognize Elaine and also Susan and make sure that we all understand that there's also another purpose tonight, and that is to keep this information, share it, spread it, because we need to help the most vulnerable people in society, and those are the sick kids, the children like Kyla, who are able to heal and get quality of life and perhaps go well beyond that with cannabis therapy. So, thank you very much for being here with us. So Dr. Zach Walsh, our presenter of the night, is extremely accomplished, and basically he holds a PhD and is an associate professor of psychology at the UBC Department of Psychology. Now, Dr. Walsh is also co-director for the Center for the Advancement of Psychological Science in the Law. Partnered with that, he is a registered clinical psychologist, and he is studying post-traumatic stress disorder. He has studied dispensaries. He's looking at their use and their value to the community and the people they serve. So I'm just going to get down from here and let Dr. Walsh continue with his presentation, and big round of applause and welcome for Dr. Zach Walsh.
Well, hi everybody. I'm Zach, and I'm really glad to be here. These kind of events are so important, and the work that Jim and the medicine tree and dispensaries are doing is absolutely essential. We can't do the research that we're so eager to do to find out how Canadians can benefit from this incredible medicine. We can't do that research if it wasn't for people pushing the boundaries and fighting for our human right to use this ancient, safe, and effective medicine. So it's a human rights issue, and people like Kyla's Quest, people like the medicine tree, really putting themselves out there to do this. It's humbling for me to be part of it, and I'm just so grateful. So thank you for having me. I'm going to just say a little bit about myself and what I do. I'm a professor at UBC. I'm a clinical psychologist. I'm a scientist, primarily a researcher, and done research in a number of different medicinal plants and substances, but primarily been working with cannabis. In that role, I've provided testimony for the House of Commons. They were rude. I provided testimony for the Uruguayan government as well, and they were very pleasant. I was recently also providing testimony at the MMAR trial, the Allard case in Vancouver, for working with John Conroy as an expert witness for that. I also run an active research lab, and I'm going to talk to you tonight about some of the research that we're doing. I think it's one of the more active cannabis research labs in Canada. So I'm excited to tell you about some work that we're doing. I've got some research that hasn't been published yet, some stuff that's hot off the press. And I also want to talk about some stuff that I think that's important coming from other researchers. Keeping up with that is a big part of my job, so I'm happy to share what I think are some of the more exciting new findings. So, without further ado, I'd like to get to that. And what I want to talk about is what are the implications of cannabis as a medicine? What does it mean? How do we understand it in medical use? What does it mean to us? And in order to do that, we really have to talk about risks and benefits, and we have to talk about alternatives, because part of the human condition is that we use medicines, and when we're selecting among medicines, we want to compare the risks and benefits of each, and not say that, not go in blindly, but figure out what's going to be the best match. So how does cannabis stack up against other medications is really the question. I've been seeing more and more in the media as there's a little bit of a backlash, I think, against medical cannabis. We've made so much progress in the last number of years, and people are now saying, oh, cannabis isn't harmless. And, that's such a ridiculous bar, because, nothing is absolutely harmless. So how is it relative to other medications? And that's really where the perspective that I want to come from. So, what are the risks and benefits of cannabis? And this is according to the DEA, so the Drug Enforcement Agency of the United States, not a friendly group to cannabis. The National Organization for the Reform of Marijuana Laws, back in 1988, tried to take them to court to have cannabis rescheduled, so that they would say that it does have some medicinal value. So this is the toughest, the toughest judge that you're going to find. This is a DEA judge from the United States, the heartland of the war on drugs, and his conclusion was that cannabis is one of the safest therapeutically active substances known to man. So that's coming from the DEA. So I think that says a lot, because that's someone who's going to be hostile to cannabis medicines. And even they weren't able to say anything when faced with the facts. And the DEA encourages you to get smart about drugs. So let's do that. Let's get a little bit smart about drugs. And what I want to talk about today is who's using cannabis for therapeutic purposes. What is it good for? Why are people using it? And how does it stack up compared to some alternative treatments for the same things? What are the consequences of cannabis use for society? So I want to look at some research on public health in Canada. And how about for mental health? Because we know, based, just on what the DEA is saying, this is a safe, physically safe substance, right? There's no toxic dosage of cannabis, and the physical consequences, negative consequences are marginal. There's a lot of benefits, but how is it harmful? Not really in any way, except when you see people with concerns. The concerns are almost always focused around mental health. And it goes back to that old stigma, the old myth that, it'll drive you crazy, reefer madness. So I want to address a little bit of that based on what we know of the data from the state of the art. And then I want to talk a little bit about access as well, because a medicine can be so effective, but if people can't access it, that really is a barrier to getting the most out of the medicine. So I want to talk a little bit about some barriers to access for cannabis, because I think it's real important. So what I want to start off with some findings from what we call the CAMPS study. It's the Cannabis Access for Medical Purposes study. It's the largest study to date of medical cannabis users in Canada, over 600. And one of my partners in this study was Rob Calloway, who spoke last night. So for those of you who saw him speak last night, I'm sure you know him, great speaker. So these are two of the studies. These have been published, and these were central in the testimony that we gave to the MMAR. So a couple of studies. And what we found in the studies, one looking at barriers, one looking at patterns of use, is looking at the reasons that people use cannabis. Oh, a little too fast. There we go. Yes. So why are people using cannabis? What are the symptoms that people are treating with cannabis? Really a basic question, but I think an interesting one. And what you see is that this is a cross disorder. So this is people with HIV, cancer, MS, arthritis, a variety of conditions. But across conditions, people use cannabis to help them with sleep, right? To help address pain, to help address anxiety. And I want to focus on those three, because those are the three most prominent symptoms that people are using cannabis for. And those are such prominent symptoms across Canada. Those are things that many of us suffer with. They're common maladies. And a lot of the pharmaceutical drugs and a lot of the treatments that we use are aimed to address those very conditions. So cannabis as well is an alternative that we need to look at when we think, how do we treat these common maladies? And what are the consequences of the alternatives? So if we look at some of the alternatives, and just starting again with this, in this case, sleep and anxiety, right? Those are big. Those are a big piece of the pie when we talk about pharmaceutical drugs. People take primarily a class of drugs called benzodiazepines, and those are used for sleep. They're used to help with anxiety. Things like Ativan, Valium, lorazepam, drugs that are going to be familiar to many of us, are the most common pharmaceutical treatments. And so if we're talking about side effects, you want to look at effectiveness, you also want to look at the side effects. If you're deciding, how am I going to treat these symptoms? And you see, these are recent studies, so 2014 and 2012, showing that benzodiazepine use is associated with Alzheimer's disease and with general dementia. So these are widely prescribed medications. A huge chunk of people who are of our seniors are using these, and across the spectrum. These are widely used in Canada, and look at these negative consequences that we don't see with cannabis. In fact, there's preliminary evidence that cannabis might be protective against some forms of dementia. So costs and benefits for things like anxiety, things like sleep, the side effect profile of cannabis is much less harmful. And the other one of those top three is pain. And of course, pain is the number one complaint. The number one medical complaint is pain. What do we do to treat pain? Well, there's a couple of options that are, endorsed by the mainstream medical community. One of those are opiates, and we know about opioid painkillers. This article in the Globe and Mail tells us what we already know, that this is a huge health problem, that people overdose and die. And even if they don't overdose and die, they're incredibly habit-forming. There's all sorts of very negative side effects with opiates that we don't see with cannabis-based medicines. What we might be less aware of are some of the negative side effects associated with other painkillers, things like aspirin, Tylenol. Those are often classed under what's called NSAID or NSAIDs, that's non-steroidal anti-inflammatory drugs. And those cause thousands of, well over 1,000 deaths in North America every year, from injuries to stomach, kidneys, from the use of these medications. So again, the options for treating something as fundamental as pain, things you can get over the counter, much more dangerous than cannabis. Could you imagine the type of media coverage that would come if there were studies showing that cannabis caused dementia, that cannabis caused mortality through damaging the gastrointestinal tract? You know, it would be all over the media. But you know, these widely used medications have those side effects that cannabis doesn't have. Cannabis doesn't damage the digestive system. It doesn't cause dementia like mainstream pharmaceutical options. So, you know, when you know all this, you see, gee, cannabis is effective. It's a lot less harmful side effects. You might think that you would want to maybe substitute these widely used medications. I mean, most of us have anti-inflammatories, Tylenol, aspirin, ibuprofen. A lot of us have opiates in the medicine cabinet as well. I know I do. But why wouldn't we substitute cannabis for those? And that, in fact, looking at some recent research that we have right now that's just being reviewed, that is in fact exactly what's happening. So this is about substituting cannabis for other drugs. And what you see is that in general, 80% of the people in our survey are using cannabis instead of some of these potentially more dangerous substances. Isn't that like to me that seems like a basic human right, to be able to select a less harmful medication that's effective. And that's exactly what people are doing, even though in many cases they're having to unfortunately break the law and put their liberty at risk to make this simple, rational, reasonable choice to use a less harmful medication for common problems. So 80% of people substituting cannabis for other prescription drugs. If we look at people who suffer primarily from pain-based maladies, you see almost 90% of people are starting to, of our medical cannabis users are using less of these damaging drugs and using cannabis instead. And when we look at the age breakdown, it's higher in the under 40s. So a huge proportion of people substituting cannabis, and it's only going to grow with the younger generation who are maybe less have bought in somewhat less to some of the anti-cannabis stigma. Another benefit of cannabis is that not only can it be a substitute for prescription medications, but it can also be a substitute for recreational drugs that are potentially more damaging, things like alcohol and other illicit drugs. And we see high levels of substitution for alcohol and illicit drugs as well. Why are people doing this? What are the reasons for substituting? Why would they use this difficult to access medication instead of the stuff that's available at the pharmacy? Well, because the side effects are less adverse. Similar to what I showed you in the last couple slides, people are starting to recognize that the side effects are more palatable with cannabis. It's less dangerous. The other reason is because it works better. So they get better symptom management from cannabis medicines. And this is primarily, I'm guessing, for opioids, but also with benzodiazepines, though Valium, Ativan, those are all have a withdrawal syndrome. Now, cannabis has a mild withdrawal syndrome, so if you're a regular cannabis user and you stop, you might have a withdrawal symptom that lasts up to a week with some sleep disturbance, maybe some irritability, but it's nothing compared to the withdrawal that you would get from opioid medications or the withdrawal that you get from benzodiazepines. So you'll hear the medical establishment talk about the risks of cannabis and about cannabis dependence, but the other substances that are being prescribed for the same conditions appear to have a much more difficult withdrawal syndrome. And people are recognizing that. That's what our study shows. And this one should be out in a couple of months. And part of a growing literature showing that people are using cannabis as a substitute for other more dangerous drugs. And that's really when we talk about what are the benefits of cannabis. Really, if people are using cannabis instead of more harmful drugs, could be a major public health benefit. And indeed, some of the initial findings are starting to show that. So this is another study. This one is just wrapping up. This is a partnership. Oh yeah, and I should mention with the CAMP study, I got to give credit where it's due. Oh, maybe I didn't put it up there. It's on here then. The Institute for Healthy Living and Chronic Disease Prevention at UBC has funded a lot of this. This study that I'm talking about now is a partnership with the Arthritis Society of Canada and the arthritis research experts, or arthritis consumer experts, sorry. Two national arthritis organizations that have the courage and foresight to engage in cannabis research, which is still stigmatized by a lot of researchers. So in this case, we surveyed people with arthritis. We weren't looking specifically at cannabis users. We weren't recruiting through dispensaries the way we have in the past, and that's important because critics would say, oh yeah, if you're just asking people who use dispensaries, you're going to get people who are really strongly pro-cannabis. You're not getting a balanced picture. But in this case, these are just arthritis users. These people didn't identify as cannabis users. We just surveyed arthritis users and found that a number of them were using cannabis. And we asked them, how does cannabis medicine compare to the other medicines that they're using? And so many of these people were also using opioids and using non-steroidal anti-inflammatories, and they said that cannabis is just as effective at directly reducing the intensity of their pain. So straight up, it's blocking the pain just as much as some of these other medicines, according to these respondents who are using both. They found that they reported that cannabis was more effective than non-steroidal anti-inflammatories, so Tylenol, ibuprofen, aspirin, when it comes to making pain more bearable, making it less irritating, and allowing them to live a normal life despite the pain. So in addition to straightforward blocking of pain, cannabis has these other benefits where it helps people live a full life with the pain and perhaps pay less attention to the pain, experience the pain as being less crushing. So that's really important because really, as healthcare professionals, what we need to be worried about is quality of life. And that's what I think this speaks to. Finally, cannabis is more effective than the anti-inflammatories and the opiates when it came to making people feel less depressed about pain. So again, quality of life is improved in people who are using cannabis to address arthritis pain. And that's a huge chunk of the medical cannabis users, is people who are using it to treat arthritis. Interesting, we asked people who weren't using it, why were you not using cannabis? And I think this is one of the first times that question's been asked on a large scale. The number one reason they gave is lung damage. Now that really speaks to misinformation about cannabis medicines. A large study from a number of years ago really surprised many of us. It was sort of one of the best news that cannabis researchers had heard, was that apparently comparing cannabis users to non-users, no increase in lung cancer. Some prior studies had not taken into account tobacco use. So because there was higher levels of tobacco use amongst cannabis users at that time, it looked as if cannabis might be damaging to the lungs. In fact, when they did the most comprehensive study, they found that cannabis is not associated with lung cancer or emphysema. The only problem that they found with the respiratory tract in cannabis was acute bronchitis, so an irritation of the throat that goes away when people stop using cannabis. So this is really misinformation. The number one reason that people aren't using it is because they're worried about their lungs. Cannabis is not damaging to the lungs, to the best of our knowledge, and it has been examined in detail, and they haven't found damage to the lungs. It also shows that people might not be aware of edibles or aware of vaporization, which takes away even the mild irritation to the lung. So misinformation, we need to continue to have events like this so people know that it is in fact a safer option in many ways. The other reason is just plain wrong, of course, that people are afraid they'd be discriminated against if they use cannabis. And finally, they're afraid that it might make them drowsy. Well, maybe. But you see the first two reasons are just based on wrong thinking. So people are not using cannabis because they don't know about what it can do to help them address their pain and potentially improve their quality of life. So I spoke a few moments ago about maybe some of the public health benefits of the increased use of cannabis. And this study is huge. It just came out last year, late last year in fact, and it's in a journal called JAMA, which is one of the most prominent medical journals in the world, maybe the most prominent medical journal in the world. And it compared over a fairly long period of time, so over 10 years, the changes in opiate overdoses in states that legalize medical cannabis versus those who don't. And the results are astounding. States with medical cannabis laws, 25% lower opioid overdose deaths. So it's saving lives. To the extent that people are using cannabis instead of opiate medications, it's saving lives, and not just a few lives. 25% reduction in opiate overdoses. So phenomenal findings. I'm going to go back to some of the research that we're doing in our lab right now, and you notice that when I looked at those, showed you those primary conditions that people are using to treat, using cannabis to treat, is both pain and anxiety and depression were high on the list. And we know those things really go together. Typically, if you have a chronic pain condition, in fact, you may very well be prescribed anti-anxiety medication or antidepressants. Anxiety can make chronic pain so much worse, and worrying about your pain can lead to making your anxiety worse. So you get this vicious cycle where your anxiety makes your pain worse, and your pain makes your anxiety worse. And one thing we're interested in is, gee, could cannabis be something that can kind of break that cycle? Is it a substance that can treat anxiety and pain at the same time and start to give people their lives back and break that cycle of pain and anxiety, break the vicious cycle? And it's not a new idea. So this quote here, you'll notice, is from around the 1840s, saying that, I saw in cannabis a means of combating the fixed ideas of depressives, disrupting the chains of their ideas, and unfocusing their attention. So those repetitive negative thoughts about pain that make pain such a more traumatic experience, the idea that cannabis might relieve those is well over 100 years old. We conducted a study, So we conducted this study, and again, this is one that we're getting ready to write up. This one was conducted last year together with the Be Kind Compassion Club in Kelowna. And I always have to thank them because I've done a lot of work with them. They do a great service to the community. This is medical cannabis users, all of whom who are using cannabis for chronic pain. And about 3/4 of them also reported using it to treat anxiety. So these are people who are generally using cannabis for the combination of pain and anxiety. And we asked them, how does cannabis work for your pain? And we found that for many of them, it directly reduces it, but it also increases quality of life. So it allows people to be more active despite the pain, less irritated, they enjoy their lives, they're less depressed about the pain. So yes, it appears that cannabis not only directly reduces pain by reducing inflammation, by tapping into some of those opiate pathways, but it also changes your attitude and perceptions to the pain to facilitate a life that is more full and less dominated by pain and suffering. And of course, anxiety is a big deal. It's a big deal in the context of pain. It's also a big deal in people without pain. So when you look at these are the most prescribed medications in Canada, and most of them are blood pressure and heart medications, and those are prescribed widely because because you take them every day. So this is in terms of just plain old dollars and number of prescriptions. Those are the big ones. But when we look at things that are used as needed, anti-anxiety medications are near the top, right? Ativan. The rest of these are blood pressure and heart medications generally. So anxiety is a big deal. It's a big part of the reasons that we use medicines here in Canada. And so we wanted to know, how does cannabis work for anxiety? And that's an ongoing question, despite the fact that people have been using cannabis to treat anxiety and depression for thousands of years, there's still a lot that's unanswered. And I'll talk about that a little bit more in a moment. This is a study of university students. And again, I'm giving you all the freshest and newest data. In 10 years, 15 years, we're going to know so much more about the medical use of cannabis. It's an exciting time right now as we're just starting to understand. So these are not medical users, or they're not identifying through a dispensary. We might make the argument that a lot of non-medical use is in fact therapeutic. It's a wellness approach, but nonetheless, these are people who wouldn't identify as medical cannabis users. And we see that amongst the frequent users, so those are people who use 4 or more times a week, their levels of anxiety are much lower. And in depression, not as much difference, but it does seem, these people seem to be less anxious, people who are using cannabis heavily. And one of the concerns that people will say about cannabis is it leads to this amotivational syndrome. It makes you depressed. It causes mental health problems. At least in terms of depression and anxiety, the evidence doesn't suggest that. It suggests that with depression, there's no difference. And in fact, cannabis use can relieve anxiety. And one thing we found that's not illustrated in this figure is that not only were people less anxious to use cannabis, they were less worried about the anxiety that they did have. So they had a more adaptive approach to managing their day-to-day anxiety. So that's what I really wanted to say about the research that we have on mental health and some stuff about substitution, but there's a couple other articles that I just had to share because I think they're so exciting. And this is just in the last couple of years talking about substitution. And I really think that's what's so important when we think about the potential benefits of cannabis medicine. If people are using cannabis as well as everything else, then, whatever. But if people are using it instead of more harmful substances, then it can have a really positive effect on society. And that's what we see right here. This is similar to the opiate overdose study, but this is looking at traffic fatalities. So if people are using cannabis instead of drinking, which is how they interpreted these results, states that legalized medical cannabis had about 10% fewer traffic fatalities. So, traffic fatality is such a huge cause of death and injury. If we can take 10% off that, 25% off opiate overdoses, we're looking at some major public health benefits. I thought I had. Sorry. Oh, that's where we go. So this is the other one that I really think is fascinating. This is looking at a study. My background in research, I did a lot of research on violence. I worked in jails in Chicago for a number of years before coming here. Originally from Winnipeg, but did my training in the States in Chicago. So a lot of my research background is looking at violence, particularly intimate partner violence or domestic violence. And that is the biggest chunk of violence in our society. We're of course worried that, we may become victimized by violence if we're out late at night or what have you, but really most violence, unfortunately, is in the home. And so if we can reduce that violence, that's huge. And this study followed a huge number of married couples over the first 9 years of their marriage. This is a really comprehensive study. And we know that alcohol, for example, and cocaine as well, drugs that are related with increased partner violence. On a heavy drinking day, people are 20 times more likely to get in a fight with their loved ones, with their family members, than on a non-drinking day. What we found amongst cannabis use was the opposite, though. In couples where both partners used cannabis, we saw the lowest levels of violence, the least violence. I also like that husbands' marijuana use predicted less violence from their wives. So husbands who smoke pot got in less trouble from their wives. Who knew? So, getting ahead of myself here. That's really what I wanted to highlight, is not just that, I think Rob probably did a great job of talking about how cannabis works in the human body, and we're starting to know more and more about the different physical conditions that cannabis can treat. So what I wanted to talk about is how can this benefit our society? And I think when we look at the potential for cannabis to substitute for these other substances that cause us so many problems, and the increase in well-being that can come with substituting cannabis for what's often a cocktail of other medications, we start to see the bigger picture of how this can really lead to a safer and healthier society if we get rid of these absurd and foolish barriers to using this ancient and effective, safe medicine. The barriers are ridiculous. I'm sure most of you who have come here know that this is, just an incredible folly. I like to think that my daughter's here now. She's 7. I'm proud to speak about cannabis in her presence, and I like to think that when she grows up, that it'll just be an option for her to improve her health if that's something that she needs. Hopefully, she doesn't need any type of treatment. If she does, I'd like to think that she'll have that option. But for now, if people want to use this medicine, this important medicine, they have limited options. It takes people who are willing to engage in brave acts of civil disobedience, people like Jim and the medicine tree. So I can't say enough about the risks and the courage of people like the medicine tree. So I want to talk a little bit about dispensaries before I close out, because I've said so much about cannabis, but how do you get it? It's not much good if you can't get it. And so we've talked to medical cannabis users who use dispensaries and who use other methods, and so we're able to provide some of the first data, some of the first hard data. We know anecdotally that people say, yeah, the dispensary is great. It makes sense that being able to buy something from a store, that's kind of the dominant model, isn't it? If you want to buy something, you go to a shop and buy it. You don't mail order it, Little House on the Prairie model or whatever they've got going now. But it's important to have that storefront access. And this data really shows it. So this is kind of a busy slide. But if you look at on the far end, this is the dispensaries. And you can see this is the number of people who say the quality of cannabis is good or very good. Almost at 100. Higher than any of the other options. So this is Health Canada, this is buying it on the street, buying it from a friend, producing your own, or having a designated producer. So these are all the options for accessing cannabis right now that we could think of. And you see the highest quality is in the dispensaries. The safest mode is the dispensaries. The most readily available, the most effective. The dispensaries perform best of all the modes of access in every area other than the cost. And of course, people find that producing their own or having a designated producer are more cost effective, and they are. They're cheaper if you can do it, but not everyone has the capacity to do that. In fact, most people don't. So dispensaries a very important role. And of course, there are limits on what dispensaries can do with pricing, given concerns that if it's that much cheaper than the going price, that there's concerns about diversion. So the cost thing I don't think is really set at the dispensary. It's set more broadly in society. So this is people who use dispensaries versus others. We also looked at people who use more than one type. So the safety of dispensaries in blue here. You see the lower scores are more safe. You see dispensaries are safer than all the other options, other than having someone else grow, which it's comparable to, but much safer than the street, much safer than a friend. The availability is also better for the clubs. Again, the blue, the lower is better. So availability, also very good. The effectiveness of the cannabis is also very good, and the quality. So storefront dispensaries, I believe, are an important aspect of access to this medicine. And to that end, we've been involved in something called the SEED project, which is the Standards Engagement Evaluation Dissemination Project. It's a partnership between UBC and the Canadian Association of Medical Cannabis Dispensaries and Canadians for Safe Access. So an organization that advocates for dispensaries and an organization that advocates for medical cannabis patients. They teamed up with us at UBC, and we had a number of meetings in Vancouver. There's one of the consultations. You see maybe some familiar faces. There's Dana Larson and a few other people from dispensaries around the Lower Mainland primarily, but we did have some people come in from the interior as well. So we consulted with patients, we consulted with dispensary operators, we consulted with people from the medical community, with stakeholders from government as well, and supported the Canadian Association of Medical Cannabis Dispensaries in producing a standards and certification program. It's very detailed, it's available online. Dispensaries can sign up to become certified, or they can just use these guidelines to help determine best practices. So I see in the media concern, there's new dispensaries popping up all the time, but primarily in Vancouver, of course. They're popping up because people want to use them, because people want to use this medicine and people want to buy it from a store the way they buy everything else. It's no mystery why they're popping up. But I think it's worth knowing that people are making efforts to follow best practices, despite the fact that this is a legal gray area, that people are facing harassment. Nonetheless, dispensaries are still working hard to provide health care in a reliable and safe environment. So the dispensaries are not just willy-nilly. There's all kinds of rules and suggested guidelines, and they in many cases work very hard to follow those. So that really covers most of the main points that I wanted to touch on. I love to take questions. So, but before I do, just to give you a quick summary, we found that cannabis is used to address some very high prevalence health concerns like chronic pain, anxiety, and sleep. The existing treatments are just insufficient or have very bad side effects. And cannabis can treat several symptoms at once with one medication that has few, if any, negative side effects, particularly long-term side effects. Some people would describe the cognitive changes, the high, as a side effect, and that's fair enough. If you work with dispensaries, you come to know that there's variation in that, and there's different types of cannabis products that can offer more or less of that if that's a concern for you. We found that cannabis is being used widely as a substitute for pharmaceutical and other medications, pharmaceutical medications and alcohol, and that this has real public health benefits. So it's reducing overdose deaths, it's reducing violence, it's reducing traffic fatalities. And those are three of the big killers, particularly of young people in our societies: accidents, violence. So tremendous public health potential. And when it comes to providing cannabis, dispensaries are really an important and effective means of doing that. So we certainly in our lab, we have tremendous respect for the work that dispensaries are doing and recognize how important and brave it is. Finally, you might say, boy, this plant's been around for 5,000 years. Is that all you got? And when are we going to find out more? And that's a good question. It's exciting for me as a scientist because some of the basic questions have still not been answered. And you might say, well, why is that? And it's because until very recently, we scientists have not had access to cannabis. So if you want to conduct a study, you have to get the cannabis, and the authorities won't allow you to say, I got it. Yeah, don't ask me where I got it from. You have to have a legitimate source, and until very recently, the only legitimate source was through the National Institute of Drug Abuse in the United States, and they would ship you what is commonly known as NIDA weed, with stems and seeds all chopped up in it, and I think it maxed out at about 4 to 6% THC. So it didn't in any way mirror the type of cannabis that medical cannabis users are using. So there was essentially almost no way to do sound research on cannabis. Fortunately, that has changed recently. with licensed producers, and I'm the lead investigator on what's going to be the first clinical trial. So a clinical trial is the gold standard for medical treatments. This is going to be the first clinical trial of cannabis for a psychiatric condition ever. Where there's a parallel study going on in the States that you might have heard of with Sue Sisley and MAPS. We're doing it here in Canada with partnered with Tilray. I don't work for Tilray, but I'm partnered with them through UBC to conduct this study. And I'm hoping this is going to be the first of many, and that over the next decade or so, we're going to have answers to some of the important and basic questions about how we can really harness the therapeutic potential of this ancient and powerful medicine. And that's it. There's my email address. I'm really easy to find. Look me up on the internet. Zach Cannabis, Zach UBC. If you can't remember my last name, you'll find me anyways. If you want to write it down, there it is. And I'm happy to take any questions if there are any. Thank you so much for your attention.
You're saying, like, I know that a lot of people associate medical dispensaries with drugs coming into their communities and stuff, but do you have any information on how medical marijuana is being used to treat addictions to cannabis, or to crystal meth, to cocaine, to opiates?
That's a great question, and so I think I touched on that with the substitution, but people directly saying, I'm addicted to this drug, how is cannabis going to help me with that?
Yeah.
I know they're trying out cannabis as a treatment for cocaine addiction in South America. I think they're trying it in Colombia, and they're also running a trial of that in Uruguay. I think it has a lot of potential. It's about harm reduction.
Yes, exactly.
So if people aren't willing to, or ready, or interested in becoming entirely abstinent, then they substitute something that's much less harmful, like cannabis. If that can help, and I think it has the potential to, I think that's fantastic. And certainly we hear so many stories, people who work in dispensaries can attest to that, so many stories of people getting off crack, getting off crystal meth, and using cannabis to help with that, and it makes sense. We need some studies, and that's a study I'd love to do. So I think over the next decade, we should see some trials of cannabis as a treatment for addictions. But now, that's a real hot potato, and I think that would be one of the more tricky studies politically to get off the ground. But it's gonna be there, and I'm pretty confident that it will be effective.
Thank you.
I mean, I think the alcohol data, over half people saying they're using cannabis instead of alcohol, and then you see these reductions in traffic fatalities, which sort of proves that they're doing that. But a controlled trial for addictions treatment, I think, is really important.
Yeah,
so
because,
thanks for raising that.
Yeah, because I end up at a lot of dispensaries at the coast and stuff, and I've talked to a multitude of people who actually attribute cannabis to them breaking the cycle of addictive drugs.
Oh, sure. People who have problems with smoking cocaine, if they're able to substitute cannabis, even if it's some really strong concentrates, they're going to put on weight. They're going to they're going to sleep. They're going to have a stable life where they can start to rebuild and grow from there. So I think it has tremendous potential.
Can you explain the process of the clinical trial that you're conducting?
Sure. So the process of the clinical trial is a double-blind clinical trial, which means that the patients don't know if they're getting the drug or they're getting a placebo. We're going to have a couple different conditions of cannabis. So there's going to be high CBD, high THC only, high CBD only, and then a placebo cannabis, which has just been washed out of the cannabinoids. So we don't know what they got. They don't know what they've got. We assess their symptoms at baseline, their PTSD symptoms. Then we send them home with one of those cannabis conditions and a vaporizer. They use it for a couple weeks. We check in with them to see how their symptoms are doing over about 3 or 4 weeks. They come back, and then we give them a different type of cannabis after a washout period, and we see if that changes their symptoms. So we're trying to figure out not only is cannabis effective for PTSD, but what strains are most effective. Because that's somewhere where there's so much wisdom in dispensaries and amongst medical cannabis users about this strain or that strain. But if you look at the formal scientific literature, there's almost nothing. So we're going to at least take some early steps at, rough comparisons of CBD versus THC.
And how long before we get any information back?
Well, we're hoping that we'll be entering the first people in the trial in late summer or early fall, and then we should be done with the study about a year and a half after that. Yeah, and we'll be reporting on it as it goes. So yeah, I'm really excited to see how that turns out. I think the next big study that I'd love to see is cannabis for sleep. So many people are using it for sleep. People use so many medications to help with sleep. No one has actually examined how cannabis stacks up. People are using cannabis anyways. Even if you're against cannabis, wouldn't you want to know whether or not it's effective? I don't know. I think it's an important study.
Oh, it's a follow-up question to the clinical trial you'll be doing with post-traumatic stress disorder. When you look at different strains and the CBD and THC content, will there be any examination of terpene profiles with that?
I think that's a great question, and I think that's something that we're also interested in, right? It's the entourage effects. How do the diverse terpenes and flavonoids and even some of the other cannabinoids impact it? But for now, just as a start, we're just looking at THC and CBD, so just the broad strokes for the first one, and then hopefully down the road, I can imagine a whole array of cannabis medicines for different conditions.
Do you know if there's any big pharma sniffing around in the development of cannabis as a medicine?
Well, it's funny. There's been attempts at that. People know about Sativex and Marinol and some synthetic dronabinol, nabilone. There's a bunch of synthetic cannabinoids. Generally, people don't find them, the patients don't like them. They don't find them to be as effective. Sometimes they have worse side effects, and they're expensive. When I was in Uruguay talking with the Uruguayan government, that they have legalized cannabis for recreational and medical purposes, and people were trying to sell them on, I think it was Sativex, which is a derivative of cannabis. It has THC and CBD in it. It costs about $10 a spray. It's a oral mucosal spray, so you spray it under your tongue, and that someone was trying to sell it on it, and they said, well, so you have this safe, effective, expensive medication that you're comparing to a safe, effective, and inexpensive medication. I prefer the inexpensive one. Reasonable enough, right? So I don't think there's going to be a lot of traction there, but certainly there's interest, and there is going to be a lot of money to be made. It can really become a big part of the economy, I think, cannabis medicines. But whether is it going to fall to big pharma? I don't know. I don't have a crystal ball, but I think not would be my guess. It's going to be hard to patent it, and I don't think people will prefer the synthetics to just the natural herbal cannabis or concentrates.
Oh, I'm blinded by the light. Yeah.
Okay. From last night's presentation and today's, my understanding then with cannabis research is it's mainly being case studies as far as health effects, but you mentioned a comparable drug that there was effects of possible Alzheimer's or dementia, and I would guess that those are long-term studies. And then, am I correct in understanding there's no long-term studies that are comparable so far with cannabis?
Yeah. So because of the studies that are referred to that suggest some potential for cannabis to prevent Alzheimer's, those are based on animal studies and studies in test tubes with cells. So they haven't been done with humans. And with studies like the benzodiazepine study I was showing that show association with Alzheimer's, because they're formally prescribed these benzodiazepines, they're able to follow them up over time, whereas there isn't a formal way of tracking cannabis users. And another thing about cannabis to date is that most people have been using cannabis of unknown quality. that could be contaminated with bacteria, it could be contaminated with different pesticides. We just don't know. I mean, until very recently, where we have reputable dispensaries, there's no way of knowing. So I'm amazed that there haven't been more negative consequences of cannabis smoking based just on some of the contamination of black market cannabis. So until we can really look at quality controlled, reliable cannabis, we won't know what the effects are. But what we do know is that even looking at dirty cannabis, there haven't been profound negative effects, which is amazing to me. Given just that there's no quality control for many years for people who are smoking cannabis. Who knows where it came from? Who knows if it was being sprayed with pesticides from the plane, if it was being smuggled in a gas tank? I mean, you know, who knows? So yeah, until maybe the last 10 years, I do think there was very few people that would have access to reasonably safe and clean cannabis. I don't know, does that get to it?
Well, I think so, but I was also curious, it's relating to last night though, is talking about the youth and the development of their brain, and if they use a fair amount of cannabis, it affecting brain development.
Well, there's certainly a lot of attention to that. I think the data is not as strong as people would like to make it out to be. I think in general, it's advisable that adolescents not use any type of psychoactive drugs while their brains are developing. But, you know, I'm also wary of people, you know, raising up concerns about children as a new prong in the war on drugs, because there's a lot of medications that, you know, have potentially harmful side effects, but we allow parents in consultation with their children, you know, depending on how old they are, to make decisions about the health and safety of those. So when it comes to medical use, I think it depends on what are the options, what is the alternative medication that the adolescent or child might be using, how effective is cannabis. So it's not just, you know, yes or no cannabis. It's got to be taken in the context of what else might be going on and what are the other options. So we see these studies of, you know, showing and the studies showing IQ drop, the one that the the Tories made such a big deal about in their ad campaigns. It's really a pretty small sample of adolescents from New Zealand who are smoking daily, and there's other studies that show no ill effects for use. So yeah, it's probably not a good idea for adolescents to be using cannabis, but it's probably not a good idea for them to be getting concussed on the hockey rink, or for them to be doing all kinds of things that damage their brain. But because we don't have these social stigmas against those behaviors, we actually celebrate them. So we get terribly concerned that, you know, some cannabis might find its way into the hands of an adolescent if we allow sick people to use it. And at the same time, you know, we stand on the sidelines and clap as they get their heads mashed playing football. So I think it's a bit of a double standard, not to diminish the potential risks. I think healthcare providers want to be extra cautious if they're considering cannabis for adolescents. But I'm also cautious about not getting too hysterical over protecting the children, because that's always been used as an excuse to oppress cannabis users. Yeah. I don't know, does that?
I appreciate your acknowledgement that maybe it's good to be careful with that age group, as well as considering concussion issues, as well as considering brain damage from too much alcohol or whatever, right?
Mm-hmm.
At that age, because, you know, that's your development age. So thank you for addressing that.
Yeah, thank you for raising it. I just think it's important that we look at it in the context of an adolescent's entire life, not just, okay, cannabis, yes or no, because then sure, it's best to be drug-free if you're an adolescent. Is that realistic? For some.
You were talking about pot of different origins and unknown quantity and quality and dirty pot, and it reminded me of something some of us of a certain age will remember. paraquat pot.
Paraguay. Yeah.
Was there any long-term studies on the people who consumed the paraquat pot?
I
Or
don't
do
think
we
there
know?
has been, no. But I'm amazed that there hasn't been more concerns because, you know, the DEA and NIDA would love to point to all this brain damage coming from cannabis, even if the brain damage was due to the fact that they're spraying it with poison. But yeah, there's not evidence, and very concerning to think about what people might have been using, and that their own government was essentially poisoning them.
Yeah.
All right, movie time. Thank you very much for your attention. It's been a real pleasure.
Yeah, so thank you very much, Dr. Zach Walsh, and thanks everyone for being part of this presentation and for watching. And we're going to roll with the movie The Culture High, which is The Union 2 by Adam Scroggey from Kelowna. So stay tuned, it's going to be fantastic. Once again, thanks to Dr. Walsh.